workplace health and safety committees. 4, the impact of the shortage of staff in hospitals. 5, the training of workers and frontline workers in particular in dealing with COVID-19. As you will recall, that this is the first kind of a virus that we are confronted with. Therefore, it required and needed some capacity building for workers and also for frontline workers in particular to be able to deal with this unknown virus. The NOB's program focused on epicenter provinces such as Eastern Cape, Gauteng, KwaZulu-Natal, and Western Cape, which helped us to empirically verify the information and complaints we received already from members in branches and regional structures. It provided an opportunity for the union's leadership to probe for more information and answers from responsible officials in the visited institution, as well as to express the union's solidarity and support for frontline workers. The program also included the donation of PPEs and immune boosters by NEHAWU as part of its contribution in the fight against the virus to frontline health workers. We did not contribute this because we are a member of NEHAWU. We distributed precisely because we are a frontline worker, irrespective of which organization you belong to, because our belief is that we need to save the nation. We are coming to the findings now of this site visits. The first finding is it relates to the lack of adequate provision of PPEs. In almost all healthcare institutions that were visited, our teams found that there were generalized shortage of PPEs. 4 months after the union was told by government that there were enough PPEs in stock and that it was undertaking additional procurement to replenish what was in the inventories and warehouses. Almost all managers did not have an idea as to how long these PPEs would last and had no plan in place to avoid stock depletions. We also found that there were challenges in relation to PPEs distribution to frontline workers. In one instance, for instance, employees, frontline workers were given a surgical mask on Friday to wear for the following week, one mask. So it became a schedule of that hospital that every Friday join the queue to get a mask for next week. Yet this mask has a lifespan in terms of time, how you must wear and use it. So they were subjected to those kind of, and unfortunately you can't wash this mask. If you wear it, you throw it. So they were repeatedly wearing it without necessarily being guided how must they protect their lives from the mask now. So that's a real issue. In some institutions, cleaning staff and porters were left unprotected because of the misconceptions that PPEs are only for clinical staff when they regularly have to clean and clear contaminated areas. In fact, in an institution like Charlotte McTyke at Johannesburg Academic Hospital, our team found that workers had to resort to using refuse bags to protect themselves. So they had to wear the plastics that are used for rubbish as part of protective clothing. The bottom line with regard to PPEs is that they were never adequate in the first place. The available PPEs are still not adequate in terms of what is experienced by our members at the institutional level and for the projected peak of the epidemic, especially when measured according to the requirements of the full complements of different categories of staff. The second finding is a lack of compliance with occupational health and safety. In all health institutions that we visited, there is a general non-compliance with the OHS Act. This is despite the fact that at the national and provincial department level, as well as the institutional level, there are officials that have been appointed or employed specifically to deal with health and safety imperatives. In fact, some of our teams had found that the authorities at the institutional level shockingly demonstrated complete ignorance of this legislation, as well as the departmental guidelines that have been issued since the outbreak of the COVID-19. Thus, from the inquiries of our teams in their engagement with the responsible authorities, none of the institutions were able to show or present to our teams the following: when and how they have embarked on the risk assessments, how the infection prevention and control measures that have been implemented are informed and linked to the risk assessment assessments that were undertaken, and whether there is a process of active monitoring and review to improve the conditions. That the occupational health and safety committees have been established according to the legislation and accordingly operational. In fact, to underscore this pervasive disregard of the law and its regulatory requirements, in all institutions, there are no regular briefings to the labor representatives on the infections, cases of self-isolation, recoveries, and fatalities. Across the board, we have found no branch of the union that expressed satisfaction with the management's consultation processes, where it is practiced. Actually, at Tigerberg Hospital, labor was not even allowed to participate in the established ad hoc COVID-19 structure. It is health workers that are more practically informed about what's happening and are most exposed to this contagion. The third issue is the shortage of staff as a finding. In all health institutions that we visited our teams, the shortage of staff was one of the primary factors that were raised, not only by workers but also by staff managers as well. Our own experiences, which were confirmed by these site visits, is that these shortages do not just involve the categories such as specialists, doctors, allied professionals, and nurses, but all different non-clinical staff as well. This generates an unbearable environment and experiences for patients and visitors. Not to mention the extreme work overload imposed upon the current workforce in the face of the COVID-19. Resultantly, the public health institutions are chronically suffering from unsanitary conditions, long queues, exhausted and irritable for workforce, amongst other negative factors. In fact, the question of shortage of staff is so pervasive across public health institutions that we visited, and in other hospitals, our teams found that nurses are being forced to do work of cleaners and porters without necessarily designated PPEs. The fourth finding, authoritarian and destabilizing management. Our team discovered that members and workers are optimized on the dropping of disciplinary measures as announced by the Minister of Health. Moreover, we also found out the following. One, when a member has tested COVID-19 positive, some managers will refuse to carry out fumigation, microbial fogging, to disinfect the affected institutions or sections thereof. Such behavior endangers the rest of the workforce as well as other patients. Two, we have a number of members, especially shop stewards, that have been victimized in one form or another, just because they have raised questions about the lack of PPEs. The absence of daily screening of healthcare workers, like myself and the deputy attended or visited one hospital here in Victoria. I visited the hospital in Eastern Cape, Udinik. I passed through a main entrance without being screened, without being sanitized, a hospital. That's what you went through as well. So that's a point that we're making. If a hospital is unable to apply the basic hygienic directives, how much more in another workplace? And the refusal by managers to allow workers to go on self-isolation if they reasonably suspected that they have been exposed. Our shop stewards have been forced to sign confidentiality forms which means that they are not supposed to report or raise concerns about how the institution is managing the COVID-19 issues. Otherwise, actions would have been taken against them if they are to do so. Managers regularly issue written warnings to workers who refuse to work under the conditions that they deem unsafe because of the lack of PPEs, despite the provisions of the OHS Act, which protects workers under such circumstances. For instance, 2 members of NEHAWU were given final written warning by management for refusing to perform their duties without PPEs at the Tigerberg Hospital. In a province such as Western Cape, managers have rejected reports of infection in the workplace from workers, and they would have even go as far as to compel such workers who may even have already diagnosed COVID-19 positive to work as long as they did not have or present symptoms. At the General Justice Kizenga Mpanza Hospital in KZN, our team found that about 2 workers have been suspended after the management refused to provide a report to them on the rising infection within the facility. Lastly, it is hardly surprising that under such circumstances depicted in the above examples, such institutions are characterized by unnecessary hostilities towards NEHAWU. That in the course of the site visit, our leadership found themselves having to deal with protest actions that had erupted. In fact, there have even been some strikes in institutions such as Livingston about over time. In Nkosi Albert Luthuli Hospital about the shortage of PPEs, Kopanong Hospital and Helen Joseph Hospitals, and have largely been caused, all these actions have been, in our view, have largely been caused by managers. The fifth finding, dysfunctional district healthcare system. Our team also noted that most of the problems that engulf the public health facilities are as a result of the dysfunctional district healthcare system. Across all health districts nationally, there are problems of coordination, complementarity, and a broken referral system. For Eastern Cape, our team found an unfolding disaster at the center of which was the maternity ward at Doranginza Hospital. The hospital is supposed to work with about 7 feeder clinics, 3 of which were closed. This resulted in overcrowding at the hospital, which exposed the already ailing people to the danger of the COVID-19. Numerous of such similar incidences have been experienced by our members and reported in media previously. Also, our members in institutions are questioning the authenticity or accuracy of the stats supplied by government on infection on a daily basis, which is a matter that will clarify as and when we ask questions. We will circulate a document to you just to strike a balance that the information on the infections and fatalities is tamsacked, is not accurate, and we will demonstrate that in this press conference. So that's a point that we're making. Almost in all institutions, it was commonly held by the frontline care workers that there was a deliberate undercounting, especially with regards to the incidences and causes of deaths. In fact, the challenges faced by the National Institute for Occupational Health, NEO, healthcare workers, dark cough surveillance system in gathering data validates this view, in that there seems to be no uniform or standardized method of recording across the institutions. Furthermore, only 18 public health institutions that are cooperating with the NEO in submitting their data on a weekly basis, whereas the private health institutions are generally cooperative. Finding number 6, the decentralized response to the epidemic, linked to the fragile district health system of centuries. Since the advent of democracy and freedom, government fully failed to develop a systematic coherent and coordinated cooperative governance and management of the public healthcare sector. So far, the response to the outbreak of the COVID-19 underscores this. Instead of centrally coordinating the procurement of PPEs and the deployment of human and material resources to ensure that intensive and high care requirements and facilities are available where they are most needed, these planning and resources imperatives were largely left to the discretion of agencies. No wonder the high level of corruption, and I'm sure we are following the story here in Gauteng of spices. I'm sure we are also following the story in KZN of PPEs and blankets proclaimed to have been bought for street kids and their prices, therefore. So that's a point that we are really making. Hence, there was a shambolic and competitive scramble amongst provinces for PEEs and other essential requirements, which led to the maldistribution of these already inadequate gathered resources. And you'll recall that the most difficult Eastern Cape, or the most province that is confronted by difficulties of resources, instead of procuring for PPEs, they chose to procure scooters that themselves are reviewing and also appreciating the irrelevance of that particular transaction. So in this regard, we will be demanding, as we demand now, the following, having concluded this interaction with institutions, the following: the full compliance of the Occupational Health and Safety Act by all workplaces, including ensuring that the risk assessments and infection control and prevention measures are put in place, and also demand for the establishment of occupational health and safety committees in all workplaces. The Occupational Health and Safety Act must be implemented in full to protect workers. Demand number 2, infected workers may only return to work on the following conditions: that they have completed the mandatory 10 days of self-isolation, they have undergone had moderate or severe illness, they strictly adhere to personal hygiene, wearing of masks and social distancing. Managers at the institutional level must closely monitor symptoms of such workers returning to work. Furthermore, we therefore call on the Department of Health to issue a circular explicitly prohibiting managers from preventing workers to go on quarantine if they believe they have been exposed, whether at home or at the workplace. The circular must explicitly prohibit managers from issuing or communicating any kind of threats or intimidating notices or letters to workers in such a way that they are forced to work when they have been diagnosed COVID-19 positive, but without symptoms, or when they have been in contact with individuals diagnosed COVID-19 positive. Demand number 3. We call on the National Department of Health to mandate the daily screening of health workers, and that it must roll out a national testing program of non-communicable diseases, as many of the frontline workers actually live with such underlying diseases without being aware, which causes complications and death when such non-communicable diseases are only discovered at a later stage, particularly when people would have been tested positive. We call on the Department of Health to engage with the Health Professions Council of South Africa, HPCA, to expedite the application and to review the postponed arrangement for the board exams for the foreign-trained doctors and other health workers, whether South African or not. Similarly, we call on the South African Nurses Council to review its decision on the restoration of the foreign-trained nurses. We also, on demand number 5, call on government to abandon the current decentralized and fragmented approach in the procurement of PPEs as determined by guidelines on the management of the coronavirus in the public service issued by the Department of Public Service and Administration. Demand number 6, that the National Department of Health must review the process of reporting on COVID-19 fatalities in all institutions to ensure adherence with the uniform standards as recommended by the World Health Organization. In this regard, we also called on the Department of Health to compel all institutional managers to regularly update NEHAWU and other trade unions on all coronavirus and COVID-19 data, especially pertaining to the health care workers in the institutions. Government must fill all vacant posts in the public health sector and ensure that we start to build building blocks for the implementation of the National Health Insurance. Demand number 8. We call on government to implement a risk allowance for the frontline workers for the hard work and sacrifice of their lives and families during this fight against this invisible enemy. This includes honoring the salary adjustment for public servants by implementing the last leg of Resolution 1 of 2018 as is, without any amendment. And as a context to the following program that I'm going to read are the findings. So based on the findings, we then taken a conscious decision that we can't fold our arms and watch our members dying, because we bury them on a daily basis. As I was coming here today, I got a call of 3 members that we have lost just this morning. So, program of action to protect workers from the virus. The recent stats by the Department of Health indicates that as of 174 healthcare workers were infected with COVID-19. Out of that 13,000, 10,275 are members of NEHAWU. And that number accounts for 78% of the overall infections. So we have lost 78% of members on the basis of these statistics in terms of the infections, while 107 workers had lost their lives. Taking into account of the 3 that I just got now, they just died this morning. And we'll illustrate the point here. There's a page that Comrade Kaya will have to circulate to show that these statistics are contested, are not accurate. And we have government who speaks about this particular stats on one hand, and the other government department speaks differently about the, because we know from where we are seated that public servants that are infected currently is 22,329. And we were told on daily basis that there are 13,174. And it can't be possible. These statistics paint a very bleak picture and prompted the National Union to adopt a national program of action that will be implemented to protect all members in all sectors it organizes. The National Union refuses to sit idle while members are infected on a daily basis. The national program will be implemented as follows. That provinces have been instructed from Saturday from the Special National Executive Committee of the meeting to continue with workplace visits and do assessments to establish state of readiness and compliance, particularly as it relates to the safety of workers. Between the period of the 30th July and the 11th August 2020, the National Union will meet workers in all sectors, so we'll be deploying the national office bearers, the provincial office bearers, and the regional office bearers to be at the workplace where workers are. And we'll go to public health, we'll go to private health, we'll go to SASA, we'll go to Lancet, we'll go to AMPAT, we'll go to NHLS, and also we'll meet the inspectors in the Department of Employment and Labor We will also interface with community health workers. We will deal with, as you know, that the president has added more responsibility for SIU. So we'll have to meet with our members there in that area. We will also meet our members in the education, in the higher education sector, both universities and TVETs, social development, as part of mobilizing towards the implementation of this plan of action that we're referring to. On the 10th August to 15th August, in the same period, the National Office will be meeting strategic partners of the union, such as SASCO, YCL, and other progressive organizations relevant to our sector where we organize, and also meet the following ministers and director generals: the Public Service Administration, Health, Employment and Labor, Trade and Industry, Social Development, Higher Education and Training, and Science and Technology, SASSA CEO and SARS Commissioner, including CEOs of the big 3 private health companies, such as Netcare, MedClinic, and Lament, and the local private hospitals. And the 2 things that we want to ascertain from them: the extent to which they have prepared the workplace to respond to the challenges of COVID-19. What are the mechanisms put in place to save the lives of frontline workers? But also to tell them who have come to a conclusion that we can no longer fold our arms watching our members being subjected to hunger and death. Because our members are caught up in between the rock and the hard place. When they comply, they die. When they complain, they are dismissed. We can't any longer subject our members to be subjected to such conditions. Generally, the working class is suffocating. There's no movement. People can no longer find ways and means of survival because of how this COVID-19 is managed by our government. So on the 21st August 2020, we will implement something we call Tsaya Letsatsi la Leave. All our members in all provinces will on this day flock to the offices of the employer and apply for a day leave. So from 8 o'clock up until the end of business, there will be long queues from our members in all sectors applying for leave for the following day as a form of signaling our impatience with the conditions and unbearable conditions that we are subjected to. So on the 21st, that's what we'll be doing. And as such, we have established war rooms across the country from region, province, and national to prepare for this. And this application of leave is a sign of protest, and it must be understood. Not because our members, they don't want to go to work, but they are signaling that they are sick and tired, and as such, they are protesting that if they are not taken serious and their lives are not at the center of what we do at the work, then they can potentially withdraw their labor. But they are signaling on the 21st. Then on the 24th to 27th August, in all sectors where we organize, we will be conducting lunch hour pickets across sectors. On the 1st and 2nd, as part of this action, in recognition of the good work and the sacrifice demonstrated by frontline workers in saving lives of South Africans at the expense of their own, we will be running programs across the country that recognizes and appreciating their efforts and their sacrifices by mobilizing motorcades, hooting as a form of saluting them for the great work despite the conditions that are subjected to as part of it, as opposed to be listening to the minister and the president, appreciating their efforts, but nothing interesting and that compensates those efforts, including protecting themselves, protecting their lives from the dangers of this COVID. So we want to be on the ground and appreciating, because we would have visited these hospitals and we would have donated PPEs, in particular the most expensive forms of PPEs, N95, face shield. We have given them immune boosters as victims, frontline workers. That's a contribution that we would have made without any tender. But because we would have spoken to our partners to make contribution so that we can contribute to those members. So we did not have to go through corruption to save lives, as is the case, particularly in government institutions. And we also note that out of that 500 billion that has been set aside through the Solidarity Fund, only 20 billion that has been taken for health, with the additional 29 billion arising from the supplementary budget as presented by the minister. And the key question is, where is 480 billion amidst the cry that we still in short of PPEs? So on the 3rd September, it will be the National Day of Action by NEHAWU in a form of demonstrations across provinces where memorandums shall be handed over targeting the President's office, the National Parliament, and all provincial and Premier's office in 9 provinces. We will be submitting those memorandums with a list of our demands and the areas of our discontent arising from the inability of our government to position our country in such a way that lives are saved. And we are going to give government 5 days to respond, and it must respond favorable to us. Failure to do so on the 10th September, at the peak time of this virus, our members will have to withdraw completely their labor in all sectors, not only hospitals, because they are not protected, so they can't. And the issue that we are making is that if you don't protect frontline workers, then we are not protecting the country. Because if the infection is directed and is really felt by frontline workers, by the time the nation comes to hospital to be attended to, there will be no one to do so. And if these frontline workers are the ones who are sick, who are infected, there will be no one to attend to the nation. And that's what must be institutionalized by the leaders with the responsibility to govern this country, with the resources that they are given. And as such, when this virus perish, we will not have a nation if we don't prioritize the life of frontline workers. So we will have a full-blown action. And that full-blown action will be in the form of a complete withdrawal of our labor. And unfortunately, that will happen at the peak of this virus. However, part of our plan, we will be also mobilizing communities or society, and we will be interfacing society and explaining our plight and our experiences with a view that society must stand up in defense of the frontline workers, because if that is not happening, that society will not have frontline workers to help them. So that's the point that we're making. So the last issue is that, which is not in the statement, is that before they leave, we will also ask our members, like any ordinary citizen of this country that is called upon by the president on behalf of the government to obey the regulations of lockdown and to respect the essence of lockdown. We'll call our members one day to join us in the lockdown to come to work as part of building to the full-blown withdrawal. So that's where our statement ends. Thank you very much, guys.
Ladies and gentlemen, that is a statement that we're presenting to you, and we'll open for questions. Those who are still
All right, that's the National Health Workers Union just giving a briefing there, stating that they have a whole host of protests and action that they're going to be doing in protest against government's inability to give them enough PPEs and create decent working conditions for them during this time of COVID. They do threaten that come the 10th of September, if their demands have not been met by government, they will down tools fully, and not just in the health sector, but across the sectors that they represent. So quite a very serious threat there, and that would be during the peak period. And so we continue.